You guys come.
Thank you very much. I think it was just coincidence that I happened to be here.
Yes.
And when I was told that I would get an opportunity to meet up with you, I said, okay, I will definitely make time. So thank you very much for the effort that you put in complementing us with your skills and knowledge in ensuring that we bring the best services to our people. I am sure MS here, he's one of my best MSs, if I can say it probably. I've always said it, and I'll still say it. No offense to my other MSs, but Dr. Chowchi, I think your leadership has indeed lifted Labasa Hospital and the service delivery to where it is today. And the fact that you are able to work well with our donors and our overseas teams that come in is a testimony of how the staff and the local community regards you. And with your work, you have developed a reputation in the health facility that has not been missed out, and I acknowledge you for all that. Thank the team at Labasa, all the doctors and the staff for the good work that you do. And like you said, we always encourage our local team to work well with our visiting teams to ensure that there is a lot of learning that takes place. And where gaps exist, we look forward to filling it with your skills and knowledge and your generosity. Today's handover is again another testimony of the fact that those Fijians who left Fiji still have Fiji at heart, and we will always welcome you. And to our overseas visitors, I'm sure you'll enjoy Fijian hospitality. And to the Board of Visitors, this is the second time I'll be thanking you today. Thank you very much for the work that you do. We expect that you will continue to work with us and in ensuring that we give the best to our people here in the north. And should you need, I mean, as a ministry, we are always ready to work with the board. We're ready to work with our visiting teams, and you can have a word that the government appreciates your efforts and your generosity. Please take back my humble gratitude to all your partners back in New Zealand, and give them a big Bilakalakalero. And while you are here, Dr. Kohli, Mr. Kohli is here. I'm sure he'll treat you to a lot of lunches and dinners. And do enjoy our Fijian hospitality, and thank you very much for these gifts. Thank you very much.
Members of Labasa Hospital Board of Visitors and friends and colleagues, we are very grateful, Minister, that you were able to take time from a busy schedule and be able to meet with us. I'll just give you a bit of background on our organization. I'm Rosy Akbar, founder of the Friends of Fiji trustees and volunteer surgeon. We as a group has set up Friends of Fiji Health 10 years ago as a sister organization to Friends of Fiji Heart. Our organization, the Friends of Fiji Health, has got 3 arms. There's the surgical, gynecology and medical. This would be our 8th mission to Fiji, and four of them has been to Labasa. This is the 4th one to Labasa, and during these trips we have done teaching and also donated the medical gear and surgical supplies. It's not only that, we have done teaching as well, which has been in the form of tutorials, seminars and hands-on teaching to the local staff. Some of the medical gear that we have donated over the years have been laparoscopic towers and instruments for the keyhole procedures, endoscopic gears, urological instruments and surgical supplies. If we add the value of all these, the gear, it will be in excess of about $1 million. So over the years we have given that much of gear to Labasa Hospital. Our missions would not be possible without the support of our our organizations in New Zealand, like Medtronic Health, Johnson & Johnson, REM, Olympus, the Grace Hospital in Tauranga, and not forgetting our volunteers who come away from their families and from their work in New Zealand to come and help us do these missions. And also when we come here, the local staff and members of the community have been very helpful to us to make these missions possible. And without taking much of our time, I would ask our team leader this time, Avinesh, to hand over the gear to the hospital and the minister.
This is one of the patients here, and there's a few more coming on the way. There will be two big machines, anesthetic machines, which will be useful here.